These are very tragic and very sad statistics. You can see that in British Columbia, just for the first half of this year, we've seen the highest number of illicit drug deaths. And the majority of those are coming from Vancouver. We're talking about 6 lives being lost to illicit drugs. We know that if we zoom out and we look at all of Canada, it's even worse, right? We're dealing with an opioid crisis. 21 people every single day are losing their lives. And as of last week when I spoke to our team members at High Hopes, about 3 to 6 overdose deaths every single day on Hastings in that few block radius of where they are. And during COVID, we know that it's been really difficult. We talk about medicine during the pandemic of isolation and people being burnt out, healthcare professionals being burnt out. We've actually seen nearly a doubling of opioid toxicity in the last 2 years compared to the previous 2 years. So this is the backdrop of what we're dealing with from a harm reduction perspective. And High Hopes is an amazing group. So pictured here is Sarah Blythe. She's the founder of High Hopes Foundation, founder of the overdose prevention site that is on Hastings in Vancouver. And she has been advocating for a very, very long time to use cannabis as a harm reduction strategy to help people find an alternative that is safer, that is healthier than opioids. And many of the opioids that they found in their neighborhood are actually laced with fentanyl, and that's why it's so deadly. And it's really incredible what they've been doing. They've actually been talking about cannabis, supplying cannabis, since pre-legalization. They got shut down, they were in the news, police were coming, and they never stopped. They set up tents. Sarah's a fighter, and she really believes, and her story is really incredible. And what's amazing is that they did stop their rec legalization because they thought, okay, well at least now there's easier access. But what they're still finding was that the illicit market was still so strong. And it's about giving patients a more accessible and more affordable option so that they could transition from these illegal products that were laced with other deadly chemicals and products and just be able to transition them off. So we often talk about cannabis. If you talk to a healthcare professional, we talk about cannabis as being sort of the off-ramp. It's an exit drug. It's not a gateway drug. And this is really important. So they recognize this, and they put in the hard work over the last couple of years to actually the right way and to actually get a license. So they received their medical sales license earlier this year in June, and to just finally be able to prescribe cannabis to medical patients that are in downtown Eastside and with a safe supply of cannabis. And so this program took a lot of time for them to get off the ground, and not surprisingly, they had support from the mayor, from the Vancouver Police Department, from the federal government, and so they really are a great success story of a model to show how we can help more patients, the ones that really need it the most, that are very vulnerable from a harm reduction perspective. And this is, some statistics that they share just to show the typical patient that they have, how vulnerable they are. Once all is said and done, they have no money left over for medication. When you're talking about the priorities of putting food on the table, putting a roof over your head, or paying for your medication, unfortunately, this is what's happening. And the price compression that was spoken about earlier is not really great for medical patients, because what's happening is that price compression that we're seeing on the recreational retail side of the business actually is what is drawing some patients away from the medical channel, and they're not actually getting great medical guidance. So these are some of their patient sort of statistics and their population. So this is what it looks like. They send us pictures all the time of their commute to work, walking, lots of tents, lots of people. It's the biggest sort of open drug market when you're in the neighborhood. And 83% of their patient population is on some sort of income assistance, and they're below the poverty rate. So they really needed to set out to find a solution that would help transition these people off of the illicit products. And some other statistics that they just shared, on what their living situation is, and also on their employment status. It's a little bit of a mixed bag, but really what this shows is that these are the people most help. And so they put out a sort of an RFP earlier this summer. So this was an article that was in StratCan. We were very fortunate that we had some of our patient advocates connect us with the group. They were looking for a licensed producer that could provide them with a very consistent, safe supply of medical cannabis. And we were really proud that after many discussions, they were very inundated for I think about a month, and they still are with requests. But we were, as Canna Farms, we're the first licensed producer in British Columbia. We developed a great relationship with them, earned their trust. They really loved the real world evidence and the data that we have on our cultivars, the research that we do through our medical clinic, Harvest Medicine. So we're one of 2 licensed producers that they're strategically partnered with at this time, and that's why I'm here representing Vivo and Canna Farms. I'm here on stage when they can't be here themselves. These are some of the initial sort of testimonials and feedback that they shared. So, just lots of thank yous and hugs. And, I think the thing that's really important, the general theme here is it's pain. There's a lot of pain and there's a lot of trauma with this group of patients, and that's why they turn to opioids. And being able to just provide a safe product that is, less expensive than the illicit market, equally accessible, and they're able to see a nurse practitioner or a doctor that specializes in addiction and in harm reduction. It's fantastic. And so at the bottom, you have a couple of the testimonials from the actual patients. We just talked about how it's helped ease them off of the harder drugs. And this is medicine. This is medicine, this is medicine, this is medicine. And so, I think there were some conversations earlier around excise tax. And High Hopes, the one thing, their biggest wish from an advocacy perspective is to please reduce or remove the excise tax for medical patients, but specifically have an exemption for harm reduction programs. Programs like this, these patients, these groups, they're a nonprofit. We shouldn't be taxing them. This is not where the government needs to be making revenue. It's just not right. The other request that they have 2. One is better reimbursement. So we know that Veterans Affairs has a very healthy reimbursement for our veterans in Canada for their service, which is fantastic. But what about, our Indigenous populations, those that are, right now very vulnerable with harm reduction, those that are in rehab or those that are in hospitals that have been admitted and are going through some sort of, addiction counseling program. These people also ideally should be accessing this medication at no cost and being able to have it reimbursed. So that's their second request. And their third request is, because a lot of these patients have been using cannabis for a very, very long time, what we do know is that you can build tolerance over time, right? So these patients typically are heavy users and they need to take a higher amount of grams per day compared to your civilian patient or regular patient. And so the other thing that they've also noticed is a gap is also in the edibles and asking for that 10 milligram lift to be a little bit higher. So those are the 3 requests from High Hopes specifically. In terms of just goals and where this program is going next, they're still in 3. They see 900 patients every single day, and right now they've serviced maybe about 100 of them. So their goal is to scale up. And for those of you that work in medical, you'll know that one of our biggest challenges is actually with recruiting prescribers. It's very challenging to find physicians and nurse practitioners who want to work in cannabis because there's still a lot of stigma. It's getting better. I'm a pharmacist myself, and I have an affiliation with the University of Toronto. The new students coming through, they're getting a little bit of more education, but it's not enough. Learning about the endocannabinoid system. This is a system in our body no different than anything else. It's about homeostasis, and so the healthcare practitioners also need to be learning about this. When that happens, we're going to see many, many more prescribers going to be open to prescribing, and we're not going to have a bottleneck with helping these types of patients. So their challenge right now is scaling up and getting not just cannabis prescribers, but those that are willing to work in the downtown east side. It's a very, very special type of personality that it requires. Then they have very ambitious plans to expand across Canada. So right now, they're in Vancouver, they're looking at the island, they're looking at other provinces. They have strong collaboration and network with other overdose prevention sites. So this is exciting news. And they're doing a lot of work to collect data, real world evidence, and to publish the research findings. So they've created their own EMR. They're working with some fantastic researchers who are trying to navigate the cannabis research system, which those of us who are in medical know it's very challenging to get funding and to get the approvals, but they're working on it. And so I'm really proud to stand here to represent sort of their ambition and their goals, because this is fantastic. And if we can show, that cannabis is a great alternative, it can help people get off of opioids and it can help reduce harder prescription drugs. This is a model that really could benefit not just people in Canada, but all over the world. So this is what High Hopes is about. I hope you'll look them up and support them, and they wish they could be here, and somebody say, thank you. Thanks for listening.